share my screen. I got it.
Yeah.
Okay.
Yes.
All right, share my screen. Now.
I see it.
Okay, great. Great. All right. So here we are. Hope everyone stay hydrated in this hot summer day. Yeah, let's get started. So this used to be called Fearing Endometriosis and Your Function, but I think it was really more after last year's lecture, Secret to Redefining Endometriosis and Relabeling Ourselves. So I'm Dr. Lin. I'll talk about myself in a little bit. And I am the CEO Director at Rehab and Revive Physical Therapy in Tustin, California, and today's event. Okay, Megan? Oh, okay. Anyway, so yeah, you never want to get in a car and not know where it's going. So today's objectives for tonight, I want to be able to give you all the latest clinical and informed knowledge. So that's like our best knowledge out there, using what's out there evidence-wise, and also what's happening in the clinic, and kind of using those and melding those together. I also want you to raise questions and shift your perspective on what is currently going on within you, within all of us who have endometriosis and are living with it, as well as enrich your life with knowledge, doesn't hurt, and empower with options. And then I want you all leave knowing what you have, and you have a choice in the matter, that you have a choice in the matter, whether it's passive, saying, you're resigned and I'm just going to, let this situation or symptoms take over, or be proactive and make some choices. What are the reasons that bring you to this lecture? I think it's great to take a little internal inventory going on. So, what is it that keeps making you search for more answers? We're all, looking for support and looking for more answers. And are you seeking support in this forum or with this lecture? You're also wanting more information, as well as, are you looking to, are you at a certain point where you want to do something? You want to make a transformation, or like before, stay aligned. Live a life in the driver's seat, or be a passenger in your health journey. So I think this is a key thing that I bring up to patients and clients here. It's just like, hey, do you want to be proactive, or do you want to stay resigned and just whatever happens and flip the wind? So, and are you interested in transformation, as well as you wanting to learn about an effective plan that can help you control the symptoms that you with? About me, there's a lot, but in just practicing for over 12 years. I've had this practice, Rehab and Revive, for over 6. And I've taught at local university, Chapman University, here in Orange County. I've written articles, I have specialties in chronic pain, and do things here at the clinic for nerve pain and organ pain and dysfunction. I've created through this and my experience NeuroMechanical therapy, and what that is a paradigm. It's a way of construct, a way to organize how we treat, using hands-on manual therapy to kind of treat it with nerves and organs first, and I'll talk about that in a little bit. I've been unfortunately number one on Yelp with the sheer number of reviews in Southern California, Orange County, for the past 5 years, and I've just spoken on NPR in the past and things like that, and learned under some great gurus of our generation and our time as physical therapists. Favorite quotes for neuromechanical therapy community is, we want to make pain managers, not pain victims. And I think there's something, it's a mindset change, it's a way to think about empowering yourself, and I believe, like I said in the slide, it's a true and necessary paradigm shift that we all have to undergo in order to making changes. Oh, I think something just popped up, but anyways, I'm still going. So what we want to do here is, so this is about what NT is, and we run with a 6-point strategy. And we like to start with believe that it's the key to unlocking that inner potential using a holistic system. So one, internal mobility. Typically, those are things like we want things inside your body to move, such as nerves and organs. Move towards external mobility. So external mobility is typically what everyone works. So it's the connective tissues, the tendons, ligaments getting stretched, getting exercises, and whatnot. The most important thing out of this is that these two, internal and external mobility, actually enhance something called that neuromuscular reflex, or NMR. And that's more of like a connection. And what I tell people in the clinic, whether they're dealing with chronic or something that's new and acute or sports related, is that it's like our body bank. It's our body capital. So you want to go and run a marathon. That's going to be debiting your account. So oftentimes when you have a surplus of capital, that's good. We want that in our savings account, our body bank, and we debit it. But oftentimes what we do is it's so close to the threshold, to the zero balance, you run below and you go in debt. And that's usually what I feel is the pain driver. It's the collector. You expend yourself past your limit, and then what happens is that you are, what happens after is that this debt collector is constantly knocking at your door, calling your cell phone, texting you all the time. And we have to help that and be efficient and effective in creating a better reflex. That's going to protect you through time. With these three, performance. So what's sitting, sleeping, standing, that's static performance. Dynamic is being able to do your, carry objects, do your chores, walk, all the things that we take for granted. On top of that is that patient-centric, driven methodologies, your goals, your habits. What are the things that we want to empower you with? So here is what that looks like. There's a bunch of arrows that go crisscross every way. They all affect one another, and I think that's what is important, that pyramid concept of that. So that's just what we talked about, and you can see how these three stack up for these two, and then really what is your goals. That's what I think is very powerful for helping patients with chronic conditions. So about endometriosis, and some of you who are new to it or have family members and you're listening, that I think it's important to know and just give a brief overview. But what is it? And then we want to talk about the function, the normal kind of biomechanics or motility is what we call that. And then I want to kind of understand causes, the causal effects, diagnosis, how it's diagnosed today, symptoms, some facts, and then why is it so painful? And what, like I said, the information that brings us my theory of what it is. So, what is it? It is a condition and dysfunction with the endometrial tissue, which is the linings of within the uterus. And what happens is it's found outside of the uterus and even surrounds organ, abdominal, and in and around abdominal cavity, but usually it's around the reproductive organs. The tissue is often sensitive, and it's sensitive to the menstrual cycles. It engorges and enlarges, kind of acts just like things when women are going through their menstrual cycle periods. So that's the brief. But I think what's important to understand is what are the normal mechanics. So I like this picture here, and this is 3D picture from Michelle Davis. That ovulation happens. These ovaries, they should ideally migrate so they can release the egg into the fallopian tubes, and then you can and it'll move the uterus for conception. The transport naturally uses our natural motions of walking, standing, sitting, and that's kind of how it passively moves it through. Oftentimes, what happens in trauma, whether it's a major or physical trauma or acute trauma such as sports injury, or you play soccer and get kicked in the abdomen, or surgeries and you build up adhesions, these are important to really know that these things are really sensitive, and they can create these adhesions or stop moving in its normal mechanical pattern. And I want to add here is the sedentary lifestyle that we all are starting to move towards in the sitting postures that we hold. So these bad habits, sometimes skin folds, really, when women sit, they sit along this plane. And then what happens is the skin folds itself, the pressure of gravity, sitting for a long time, that prevents these ovaries from happening. And then maybe these scar tissues start forming, things get released, these eggs get released outside, and that's what some people end up with, these cysts. So that's an interesting way of looking at it. It's a theory, but just kind of, like I said, this is use some of the evidence that's out there and what we are doing at the clinic. So then also it happens normally is that the ovary, usually you're ovulating, it alternates 1 month this way and 1 month that way. So that's right, and then it alternates. That's normal behavior. It's a normal pattern. So sometimes you might have a flare-up alternating every other month, and you really realize that's what's going on. And so you might be able to predict which side or which month is going to be a bad month, and you want to plan accordingly. And so we want to make you pain managers once again. So is dysmenorrhea? Dysmenorrhea, is it hereditary? Often a lot of people say, my mom had it, my grandmother had these conditions, or we kind of go down that design thoughts. Like, I'm going to have this forever. Is this something that I have to live with? Overview, and this is some causes, but there's many. A lot of things are inconsistent. There's a lot of theories, so you're going to hear my theory. There's a lot of unknown causes, but we have a few running prevalent ones. I've got the genetic one, like I said before, and this is where these are just passed through these tissues, are distributed through the blood and the lymph. But oftentimes you'll hear these things kind of set off after surgeries, whether a C-section, whatnot. And then these things are these scar formations. So that's often this in the Digestive Surgery Journal, that in the pelvis, abdomen, these adhesions can form. Sorry about that. Another theory you suggest is, other theories that there might be remnants from the embryo when those control. There's like chemical, environmental reasons. So some of the causes that we may go through. Some of the big ones that I've heard, and believe it or not, these are quite quickly in this order, what people have also often complained about to me. So pain before and during periods. Sorry about that. Pain with sex. We can laugh about it. It's an uncomfortable conversation to have with the doctors, or that you may have with doctors. But feel free. You need to talk about this. Being intimate with your partners, your spouses. That's an important quality of life issue, and we want to know. So fertility is a big one, and then fatigue, painful urination during periods, painful bowel movements, and usually there's GI disruptions, diarrhea, constipation. This goes on. And just systemically, what I see is there's other things that are you're suffering from, allergies, chemical sensitivities, frequent yeast infections, and we do all these things in this manner. I believe it's something to do with inflammation, systemic inflammation, and I think some people inherently have a little bit more inflammation that run through their body, or their inflammation index is higher in some of these people. So I think that's what's out there, and I've with a lot of inflammation myself, so I have to learn how to control it. And the list goes on. There's a whole bunch of these. You can go on curetogether.com or Google a bunch of this. But here's also found on Google. Incidence is every about 3 million cases per year. Like I said, diagnosis really can be done through laparoscopy, but who wants to be opened up? And some of you might have already out there. It's usually anesthesia, show the location, the sizes, and then open up with surgery, and then having a possibility of this surgery creating more adhesions. Is that really worth it? And a lot of you out there who suffer or live with endometriosis, living poor quality of lives, and I've heard them time again. So and then a lot of people are seeking answers worldwide. They'll travel wherever, conventionally and unconventionally. So that's a known thing. So like I said, we were trying to redefine and relabel, in fact, kind of what you think about endometriosis. It's a label. But, you know, if you think quiet to yourselves, how does it affect functionally? You know, how does it keep you from living the life you've always wanted to live? So we are out here for information, and that's great, but we need transformation, as I always say. We find a way to transform. You're going to, you know, a lot will live with these labels. I have hernias in my back. I live with it, but, you know, I can move and work and do the things that I need to do without suffering from the symptoms. So we transformation. We need a plan, a roadmap, and then, you know, how do we move on? How do we keep living on? Is really key. So this is a top secret. This is my theory, and I kind of alluded to it already. But I believe that scarring, you know, once the lining and inflammation goes uncontrolled, and basically it's like, I call it the pancake. Adhesions are like pancakes. So you dump syrup on pancake, you walk away for 5 minutes over the stack of pancakes, and then you try to peel it off, and it's harder to peel off. Every time you try to peel off, guess what? You know, what happens is it just kind of rips a little, and imagine that happening to our tissues. That can create more inflammation, more scar tissue, so on and so forth. And a lot of times, the issue can be managed through diet, physical therapy, manual physical therapy, strengthening exercises, stress management. A lot of people do meditation, and really understand, you know, being able to change habits. So then is, what if the scarring overproduces because of this inflammation index? And like I said, I think some of us live with more inflammation than others. And then then you add on habits such as sitting and lack of movement, and then so on and so forth. I've got some wild theories as well that restrictive garments, I think some elasticity or elastic pants that we have and the compression shorts are so good, they actually are restricting normal mechanics of our organs and normal mechanics. So these things, you know, are really something to think about. And, you know, I'm just throwing it out there, but we do everything and try to help and manage all little pieces of someone's life, and just, hey, let's just reduce these things and see what happens. So, you know, what is it that we feel what we feel? And I guess I put the F a little further. So sorry about that. But like I said, I think nerve inflammation and these adhesions and scar tissues, and you kind of see this picture here, and, you know, trying to rip that, you know, these things are going to be painful. A patient of mine saw something somewhere and to me that blisters is a way to describe this. So, you know, we get blisters if we're, like, you know, swinging the hammer too much, but those that, and I like the way she phrased it, but it's like living with blisters on the inside. And for people who don't understand, it's a lot of these things. This thing in the inside is like a blister. It feels like a blister. We want to help manage that. So, you know, also it's so painful. I believe that tissues should lengthen and shorten. So all connective tissues should have that ability to slide and glide and, you know, roll past each other. And that's that ability. It's like oil and water. You want oil and water to kind of glide past each other. So adhesions do restrict movements, and that's why I wager about function. Sometimes there's a lack of lengthening, which feels like a pulling, stretching sensation. And then adhesion, sometimes if it's blocking you, you kind of run to it, and it limits the ability for it to glide further away. So those are interesting things that we want to think about ahead of time. So here's a case study of one of my patients. We have a 40-year-old female. She had vaginal birth to two beautiful daughters, and then she developed endometriosis, ended up with a total hysterectomy in 2012. And her symptoms were abdominal bowel pain or flare-ups. This pressure belly is basically like a swollen belly that's bloated and squishy. We have swelling that kind of systemically moves around. Once again, I think there's like a systemic inflammation, but swelling ankles, shoulder pain. She had 7 fibroid formations, periods of unrest, even though she went to bed for 8 hours. And just a cognitive belief is that she had inflammation. A lot of the inflammation that she has is also contributed by her diet, which may or may not be part of it. But I think the things to manage if we can. Functional and life losses that she incurred. So basically, she's unable to sit, during her menstrual cycles, and really think about pain. I'll say which is triggered by the brain. These hormonal things that are going on is happening in the brain. But guess what? Pain is also interpreted in the brain, and that's an important thing to think about. It's like this brain thing. We're going to go back to it in a little bit, but we're about managing things in the brain as well, or the nerves that go to the brain. So she had loss of enjoyment and withdrawal from work, and intimacy. Like I said, it's a big one for a lot of folks. Family relations and the community she was involved in. She was involved with her church. So a lot of these things that she wanted to do, lifestyle, quality of life, just became poor. And a lot of you out there have had something similar. So we help her. Within 10 visits, 10 visits time, and this little graph here is with physical therapy. It helps improve this, but basically went through these goals. We were able to, give her extensive ownership of her exercise, make her a pain manager, empower her with the right tools, and then wanted to, like I said, manage inflammation. So anything that was creating internal stress, external stress, what it may be, whether it's physical, mental. I want to keep educating and training on her core muscles, that abdominal brace that is really important, and then use that education to enhance her function by teaching the right habits and postures that will decrease irritation. Adjust her environment. We did a lot of strategy talk about adjusting things in car, the workstation, and church. So our secret and why it worked. Let's go back to 6-point strategy. And I believe, like I said, it kind of encompasses it all, covers all the bases, and the goal is function. So it's a strategy that we want to live with. So this is kind of how I believe a lot of these treatments are working here at Rehab and Revive. And we believe that the intermobility, this goes back to the brain and how all these things. But the most important one is this vagus nerve. This is called the wandering nerve. It wanders and enhances itself all through our body. It goes to uterus, ovary, our sexually reproductive organs. But it almost has its hand in just about everything. And then we wanted to manage things in her from the spinal nerves, the lumbosacral plexus. Those are the nerves that create sciatica, whatnot. So we want to we free those up. Adhesions. There's adhesions in the organs as well. So organs like the bladder work sliding and gliding past each other. We do that externally. Some PTs, women's health or men's health PTs can go internally as well, and they'll go through your orifice. And then she's had hysterectomy, scarring that's around the uterus, fallopian tubes, ovaries, and then we always wanted to kind of read it around when she was having a menstrual cycle. So those that didn't get anything removed, these are really important to enhance that sliding and gliding. And then the rectal, the colon, and the ascending and descending colons. We want to get those things free so they don't cause any more internal mechanical stress when they bump into each other. They should slide past each other. External mobility, really important, and what my mentor Greg Johnson has called it is muscle or tissue play, the ability to slide, glide, roll, spin past each other. But a big thing that that decreases some of these forces is our thorax, our rib cage, and so we want things optimal. And in the importance of this, if you think about a core as a giant ball, if it's a giant ball, then the top of that ball is actually the diaphragm. So we do a lot of things with diaphragmatic exercises. But we want to beat that abdomen, pelvis, which is the floor of the ball, the abdomen, or your six-pack muscles and your transversus abdominis. Those are the big words that are out there, are actually the wall that go around that abdomen. So improve and enhance that external mobility. But like I said, only it comes down to this response, this reflex, which is that body bank. We want to create these protective mechanisms. We have functional testing measures and outcome measures to test and mark improvement, but we need to enhance this. And there's a bunch of techniques. It's hard to show over slides, but there's a bunch of techniques that we use to help increase balance, create that automatic core response. And just you don't have to think about it. That way you can go pick up your son or daughter without thinking about getting a flare-up. It should happen. It just should be automatic. We want to use stabilizing exercises and other techniques. I wanted to talk about habits, right? Static and dynamic performance. We want to improve postures for walking, standing, sitting, sleeping, car, sit to stand. So you can see this is kind of it's a non-medicinal, non-surgical, multifaceted, solution-based care. We want to, like I said, we talked about habits. We want to improve that reflex, build strength, improve mechanical function, free scar tissue, free up the nerves, ability to slide and glide, and we do it conservatively as well if people are sensitive. Decrease that inflammation that can come from anywhere and anything and any way. So and then sometimes people get lymphatic work. So it's being that pain manager instead of that pain victim. So then today, and it's great. I love talking about this story. She, after about 10 visits, and then she progressed to more maintenance once a month. She was able to travel. Imagine traveling. Be able to fly to China, scale the Great Wall, go to India. Teaches a caseload at a local university. In that time, she was working on 2 textbooks, able to finish those and publish them. And just a happy person, mother, wife, family member, and times she even joked with me that able to jog for a few minutes just for fun, just for exercise. So isn't that a great thing for us to move? So this is she let us use her picture. So she's able to she scaled this strenuous mountain in Los Angeles. So thanks for sharing, Kyle. So what's next? And I put this slide here as a pseudo joke, but like I said, intimacy is a big one. But is it this is important? Is it a joke to improve orgasm, desire, pain? And I said choose to revive and improve life. So the things that we use, just a little blurb. I've decided, because of all the patients with chronic pain, I've created something called the Body Academy. It's a full-on beginning to end process that you become that pain manager. So it's tailored by me. We go through it together, and then you basically it's custom to every individual. Everyone lives with something different. But the best is we work on your whole body, just like I mentioned before with our patient. This one-on treatment, all hands-on, and we believe that it helps give faster recovery rate. No limitations, so we just go after it because we are out network provider, and then sometimes we just need that partner in this process. So that communication is really important. I think that enhances progress. Feels like you have someone along this journey. And then because of my training, I believe precision and accuracy will give us longer lasting benefits. And so the transformation that usually occurs, everyone that comes through this finishes the program usually has 100% improvement in these gains. It's great. This is a great measure for our clinic. We have testing for that, and we just mark it. And then just generally, there's guidelines that we have. Our national APTA, American Physical Therapy Association. It's 2 times faster than your conventional, regular gym type physical therapy, like conveyor belt mill type physical therapy. So I think it's important to have that individual one-on-one care. Also, some of you who may be hailing from different parts of town, we are in a beta. Just for your information, we're beta of testing something for lower back pain. If you're interested, you can feel free to contact us personally, and I'll have my email in the coming slides. But it's electronics. We do webinar kind of like this, and we go through chat and with a few other people that live back pain. So, but in the future, we'll maybe develop something for endometriosis for people that are far away. They can't make drive to Tustin, California. So this is kind of what we do, and we want to give that then we want to provide stellar customer service to help everyone manage their own pain per exercise and the progression of these exercises. Because ultimately, it's the exercises, just the hands-on work that create that glue. So I think progressively moving people along the right way at the right time is going to make you smarter. So don't work harder. Heal smarter, not harder. That's our little a slogan. Also, if you just need to feel good, stories, change your paradigm and the way you look at courage in spite of pathologies. I wrote a book a couple years ago. It's called Rehab the Mind, Revive the Body. You can find that on Amazon, and you can or Kindle, and that's on Amazon. Or you just look me up, Dr. Justin Lin, and it should be up there. So these things, it's a short read, but I think it's important to get that foundational step, that principle in healing. It's that mindset. Remember, like I said, that hormonal stuff happens in the mind, and the pain that interpreted is also happening in the mind. So here are some resources I used. Well, and stay connected is what we have here. So this is all our information. We dig on social media, a lot of things on YouTube, Facebook. Please like us. You can email us at info@Rehab and Revive, or check out our email, and on the bottom of our check out our website. At the bottom of our website, you can put your email in for our newsletter, and we hashtag usually all this stuff. That's another modern day, but that's pretty much it for we have here, and I think we can open up to Q&A. Hello.
Definitely. Thank you so much, Dr. Lin, for sharing. And we're going to go ahead and open it to Q&A right now. So if you guys look on the side, you can just send any of your questions. And I've received some already. So to combat the issues of a sedentary lifestyle, how often should a typical woman be exercising?
To combat, so just to repeat myself, to combat a sedentary lifestyle, how often? The frequency. So typically, good ways to go about manage it slowly. We really do believe that, they say that 30 minutes a day from the American Heart of walking is good. At least start there. I think every day isn't bad. Doesn't have to be strenuous. Just move your heartbeat like 10, 20 more beats per minute is going to have a lot of benefits. Just like I said, things with the endometriosis of just sitting all day really can disrupt those normal biomechanics at the uterus and the ovaries and all those endometrial tissues that just need movement. We need movement. I think it's important.
Wonderful. So our next question is, do you believe endometriosis is purely hereditary or just become very common in women?
Like I said in the lecture, I think there probably is a hereditary component, but in a sense, what the hereditary component, if I wasn't making myself clear, is that it's that inflammation index. I believe my mother is the person that is inflamed more often than not, whether it's personality or her body with injuries. My father doesn't. My sister is fine. I happen to be the one that got that inflammation index. Now, it can manifest anywhere. I can tell you, for me in particular, it manifested in my organs as being stuck, constipation, and I did a lot of training and also got body work done with that. But so, the hereditary, I think there is a component, but I think a lot of times is, it manifests itself more and more now because of these sedentary or restrictive environments or activities that can flare up that we're just not getting proper education now at the changing and all these things. And like I said, I think diet has a huge component as well. So it's a multifaceted condition that always have to be managing it. And whether you have it or you don't have it, It's just being able to take further and just controlling it, empowering ourselves with the right tools.
Our next question is, are there any specific stretches or exercises that we can do at home to make us feel better during our menstrual cycles?
So that's hard to say. I think every individual is different. And I'm going to defer to whoever, like, if that might be taking care of you, like what your limitations are. So that's a little harder to answer. I'm sorry. Yeah, everyone's a little different, and everyone with every client that has endometriosis might have, like, let's say, the hysterectomy or not. So my apologies. That's a touchy one to give just a general blanket one over internet.
Of course, totally understandable. Our next question is, do you see a connection regarding inflammation between people with endometriosis and inflammation in other areas of their body?
Yeah, absolutely. Yeah, and that's why I put the little case study up that their shoulder pain, swelling, headaches are big ones. That also coincide with the menstrual cycle. And so yeah, inflammation doesn't have to be a huge, full-blown, gouty-looking ankle. It's just that puffiness, that warmness, an inability for things to circulate. So yeah, I think it runs prevalent. It's very prevalent in the population that I see.
Awesome. Our last question that we'll take is actually a good one to end on. She says, where can individuals go to receive more information about you? And so I just want to draw everyone's attention one last time to this last slide he's brought up with all these wonderful resources. And thank Dr. Lynn again for speaking with us. I want to go ahead and remind everyone that there will be a recording of this, and we will post it on our Facebook as well as adding it up on our YouTube for everyone to enjoy. So thank you again, Dr. Lynn.
Thank you. Yeah, please take a look at our social media. We try to pump out as much as possible when I have a free second. But yeah, this is a wonderful avenue. And you can email us privately if questions or interested in coming for treatment and see what we have to offer. So thank you for your time, everyone, wherever you are at, and I do appreciate the opportunity to speak to you all.
Everyone has a good evening, and we'll see you next time.